Take a trip with us to learn about some of your neighbors with this edition of KXCR Conversations. These are neighbors just like you and me, and how their lives are filled with history. KXCR Conversations with you.
Hi, I'm Pip Cole. Today I'll be conversing with Sandy Fleetwood and Ron Ferrand. They're both nurses at Peace Health Hospital. How are you?
Oh, I'm doing just fine, thank you.
Good. To provide some background for our listeners, I'd like to know, where were you raised and where did you go to high school?
So I was actually born in Oregon,
Yes.
so I'm a true Oregonian. I was raised a little bit of everywhere. My family traveled around a lot, so many states, but we always ended up back here in Oregon.
Uh-huh.
And same thing happened to me. When I graduated high school, I went down to California, lived that big lifestyle and decided that wasn't for me and came back to Oregon.
Uh-huh.
So Oregon grown.
How long have you been in Florence?
I've been in Florence, I'm going on 9 years now.
Uh-huh. Uh-huh.
So, and I love it. I love the coast, I love the community, and I love the people.
Oh, good. And have you been a nurse for a long time?
I've been a nurse for over 20 years. I've been in healthcare since 1979.
Wow.
So I've also worked down in Southern Oregon in the Medford region. I have worked in Rogue Valley Medical Center. I have worked at Providence down there.
Okay.
And then prior to becoming a nurse, I worked also down in California at multiple hospitals down there.
Oh, I see. Okay. Good, good. And Ron, how are you today?
I'm well, thank you.
Okay. Where were you raised?
Well, I'm a California native, but I've lived most of my life in the Northwest since 67, since 72 in the Eugene area. Uh-huh. I've worked in healthcare all my adult life since 75. I went in the Army and was an Army medic and then a clinical specialist in field hospitals and station hospitals. Did 3 overseas deployments, and I've been a nurse since 84, working at this facility since 91.
Uh-huh. So you got your nurse's training in the armed forces?
No, my nurse's training started... my healthcare training started in the armed forces, but my nursing training was here in Oregon at LCC.
Uh-huh. Okay. Sounds like a good background. So what's currently going on at Peace Health here in Florence?
Well, we're currently in contract negotiations. We entered into negotiations in December. Our contract was extended in January to the end of January, and we've been currently working without a contract since January 31st.
What does that mean, that you're working without a contract?
Well, our contract provisions are still being followed, but our employer doesn't have to follow parts of the contract, such as the grievance process. We've completed negotiations and not come to agreement, and now we're moving to mediation with a federal mediator to facilitate that process.
Oh, I see. Sandy, this is part of the Oregon Nurses Association, right? Isn't that your union?
Correct.
Okay. Can you tell us a little bit about that?
About the union itself?
How many members are here?
So in our union, we have 72 nurses.
Okay.
And it's the Oregon Nurses Association, so because of that, it's just nurses that we have in our group here. So that does not encompass any other healthcare people, like CNAs or any of those other people. Doctors, hospitalists, techs.
Okay.
Yeah.
So what are some of the problems negotiating a new contract?
So negotiating a new contract, both sides bring items to the table that they would like to either have added or deleted to a contract.
Okay.
And this term, we brought forth quite a few requests. Some of them just clarification of information, but also some items that we would like brought back on into our contract from past contracts.
Okay.
and then some new items also.
Uh-huh.
And the other side, they brought forth a few items, but also took away or were requesting to take away a number of items.
So, Ron, what's at the top of your list in this negotiations?
Healthcare benefits. Our healthcare benefits have degraded in recent times since our last 2 contracts under the Affordable Care Act, and we want to seek a return of some of our healthcare benefits. Nursing nationally is an aging group. We're a lot of baby boomers predominantly, and we're getting older like the rest of the community. And with that, we're going to have more health care needs, and we want to ensure that those are taken care of.
Uh-huh. What kind of rationale did they use to degrade your health care benefits?
They've said they want to have a standard health plan throughout the organization. Our last contract, when the Affordable Care Act was coming into play, they said they would be taxed on the current tax plan, that it would be viewed as a Cadillac health insurance plan, when in fact now we've seen it hasn't been taxed, and our labor relations person, Gary Aguiar, has said, and it looks like it will never be taxed. In the meantime, contrasting that, back in that time, hospitals nationwide had a large charity care burden on their financial structure. Greater than 10% was the norm, and that's been reduced to about 2%, largely because of the Affordable Care Act. And now most people have health insurance.
Yeah. Sandy, can you add to that?
Healthcare definitely is at the top of our list, but we would like to have security 24 hours a day, 7 days a week at our facility.
What does that mean?
Currently, we have a security officer that Peace Health has hired, 2 of them actually, because they switch off. So they are there 24 hours a day on the weekends, and then from 6 o'clock at night until 6 o'clock in the morning on the weekdays.
Okay.
And it's nice to have just a show of a uniform. If you have a patient or a visitor or even an uninvited guest show up and that is not acting appropriately to be in the facility. Before last year, we had no security, and if we needed help, we would contact our local police agencies, like the city police, and if they were available, they would come and assist us when we needed it. But we have had a situation where they were not available more than once last year. But the one time last year that kind of pushed us over the edge was we didn't have them be available. They're busy and they're short-staffed also, and we can understand that.
Right.
And then we contacted the county sheriff, and they were not available either. And we know about their plight in Lane County.
Right.
Everybody kind of does. And so then we contacted the state police, and they were also not available. So that left us kind of in a lurch in a situation that could have turned out very bad. Luckily, it diffused itself, and nobody was hurt.
Are there other issues from either of you?
Yes, staffing. This is an issue throughout the nation, and we know, especially in the Northwest, that our sister hospitals are also struggling with that. Again, as I had mentioned, nursing as a profession is largely baby boomers, and they're going to be retiring over the next decade. Oregon is projected to have a nursing shortage of 6,000 nurses in the next 5 to 10 years. So our goal is to retain the nurses that we have, recruit other nurses, and be able to have nurses for short-term needs.
How is the recruitment done?
Well, we have our organization has a centralized structure, and their recruiting is led through Vancouver, the headquarters in Vancouver. They place ads in various publications, and they may get some internal leads and follow those. And then when nurses contact them, they initiate a recruiting process.
Now, Sandy, you were talking earlier about the turnover you've seen in the 9 years you've been here.
So I work in the surgical services department, and I've been here almost 9 years. It'll be 9 years in August. And in that time, I have seen their turnover in the OR, in the operating room area, turnover a couple times. We only have one person in there that's been there longer than me. And in our recovery room area, we're kind of suffering that same turnover problem. And in our outpatient infusion department, it's a rotational effect there.
So not all nurses want to come to a rural area.
Not all nurses want to come here. Some of them think that, it'll be a grand place, and then maybe, they don't like the fact that there's not the great shopping. We don't have, the cultural arts like they want. And then, some people just don't like the wind. And so if we can't offer competitive wages, if we can't offer competitive benefit packages, we're not going to be able to entice people to come here to see if they would even enjoy it here, let alone retain them.
Okay, so that's part of your negotiations too, is these benefits that keep people in Florence and willing to work here and wanting to live here.
Right.
Are there other issues that are on the plate?
There is. It's related to the staffing. If we have short-term needs, we have a very small relief pool. What that means is that's nurses who don't work a regular schedule, and they may pick up some of their work days on the schedule, but after the schedule's been posted, if we have an illness or an influx of patients that exceeds the staffing that's on duty, we need to pull from a pool, and we have a very small pool. If we get too many of those short-term needs, we don't really have a good pool to draw from. About 15 years ago, we used to get agency nurses from nursing agencies. That's how I started at Peace Harbor, with a nursing agency. We rarely see them now. Sometimes we'll get contract nurses through those agencies on set. For example, maybe a 13-week contract. Those are for known shortages that are going to be for extended periods if a nurse is out on a medical leave, for example. But we don't have a good pool of nurses. So our pool is, besides those relief nurses, it's the regular staff that are already working with healthcare, and especially hospital nursing. You give up, you're going to be working every other weekend. And so I've done that most of my adult life. So right there, you're giving up half of the weekends that you would normally spend with your family or friends. And then on top of that, you may be called upon to fill in those short-term needs too. And nursing as a group of professionals generally are upbeat and will step up. But when the demand is increased, it can put a burden on individual, not only physically but psychologically and spiritually. And excess, when it occurs in excess, it could lead to burnout.
Sure. I imagine it's a very stressful job. A lot of people could not do what you folks do, but we are very thankful you're out there.
Well, you balance that with joy that you receive from helping people, and on those occasions when they thank you for your care, that's our reward.
Oh, sure. Would you characterize your current situation as short-staffed?
Not on a regular basis.
Maybe that's a good time for us to take a short break.
So tell me your love sincere, oh please be kind. Tell me I needn't fear, oh please be kind. 'Cause if you believe me, dear, I know my heart will lose its mind. If you love me,
This is Pip Cole for Community Conversations, and joining me today in the lovely studios of KXCR Midtown Florence are Sandy Fleetwood and Ron Ferrand. Now, you're negotiating a contract. Could you, either one of you, tell me about the process of a contract when a contract is up and you haven't got something to replace it with? What do we go through? What are the phases we go through here?
We're continuing to negotiate with the hospital. You can continue to negotiate after the contract's expired as long as you have items that you feel that you may be able to arrive at a mutual consensus on. But when you get to a point where you're not making headway and you're seeing an impasse, then we involve a federal mediator or a federal employer through the Federal Mediation and Conciliation Services, and we currently have a schedule to meet with that mediator and the hospital on April 10th.
And I think the difference this time for negotiations versus our past negotiations is we're not negotiating with just people from our facility, from the hospital here.
I see.
In the past, so it's been people from our facility and then Peace Health's attorney. This year, it's corporate. And on the other side of the table, there's just one person from our facility, and that's our director of nurses, Lori Kobe. So it makes it a little bit more of a challenge because the people sitting across the table from us really have no skin in the game.
I understand that. So this can go on quite a while. How long can this whole process go on? Do you have any idea?
Till we reach an agreement.
So the issues you've outlined so far, those are important to you guys. Now, what's important to corporate headquarters?
Standardizing the healthcare plan, holding down the labor costs of their overhead.
How about recruitment and retention?
I'm sure that's important to them also. Nursing is the largest, I'd say, of the professions that work in the hospital. It's a big need for them to have quality nurses also.
Including the pool you're talking about, backup?
Yes.
Okay, sure. Are there time limits to this whole process?
Not really.
Can you go a whole year without a contract?
Yes, there have been hospitals, I believe, that have gone more than a year.
Wow.
Usually that's in their initial contract. They don't usually go that long a period with an open contract.
Yeah, so you have items on your contract already that are not disputed and that both sides agree upon, but there are some that you're talking about.
Yes. If we still don't have an agreement, we could pursue further mediation sessions. At some point, if we still can't come into agreement, the hospital may give us their last best offer, and we can either choose to work under that or we could enter into labor disruption.
A strike you're talking about?
Yes, general strike.
Okay. And now, when they come back with their best offer, what do you do? Do you vote? Do you have a consensus process? 75 nurses here?
Yes, we could vote on an offer.
Okay. Discuss it and, see how much you're willing to give or how much you won't budge on certain issues. How does this affect both of your jobs?
Well, it adds to the stress in our lives. We've spent quite a bit of time preparing for the negotiations, and we have to use our vacation time to cover the days off we're at negotiations. The hospital had paid our team the previous 2 contracts, expressed that they weren't interested in doing that this time. Also, at the table, they've been just rejecting a lot of our proposals and not giving us a lot of counter proposals. Our last session, though, had some promise. We did get some proposals from the hospital, which we accepted, but then the last day, we made a package that would address everything on the table that we wanted to address. We withdrew quite a number of items, and they rejected that without a counter proposal. Our labor rep, Gary Aguiar, even offered to negotiate some of the items that we thought they were close on to get them off the table, and they declined to continue negotiation on that day.
At what point, Sandy, does arbitration come into this?
So in the state of Oregon, I've been told that we don't go to arbitration.
Oh, okay. Uh-huh. The Sacred Heart in Eugene, are they operating under the same constraints that you guys are here?
Yes. Sacred Heart operates with the same concerns we do. Their bargaining unit, that was their top priority, healthcare and staffing. They have a larger labor pool, though, so they have more resources to draw from for short-term needs. However, with that said, they have a lot of open positions, and they run about 85% capacity. So there are times that they're not accepting patients. If we need to send someone over to Sacred Heart from our hospital, we have to find someplace else to send them to because they don't have enough staff or they don't have open beds.
And with that being said, as far as pay, it is a larger facility. They do get paid more. And so you would think that they would have more nurses. Well, they do have more nurses, percentage-wise, but they're still short-staffed also.
Is this a nationwide trend, or is this just local? Or
Nationwide.
People are not going into nursing so much, huh? Or
no, it's harder to get into. There are many qualified applicants who've gone to college, taken their pre-nursing, and they can't get accepted in a program. I know of some locally here that are in that category.
And the reason being is because there's just not enough nursing instructors.
I see.
And the pay for instructors versus what they can make like in a hospital or even a clinic setting is a lot less. And it's more demanding to be a professor than it would be to be a hospital nurse. When you're a professor, you teach your class, but then you have all these other activities that you are required to do.
Sure.
And it's kind of a three-part system. And so a lot of times people think, yeah, I'd love to be an instructor. They get in there and go, oh, no, this isn't for me because I can make a lot more money outside of education.
Sure.
So now we have an education crisis, too.
Can you please explain overtime and on-call time policies here locally?
So overtime is usually if you work past your standard schedule.
Okay.
So for me, I'm an 8-hour nurse.
Okay.
And if I work past 8 hours, I get time and a half. In the surgical services area, we don't have 3 shifts like they do on the regular nursing floor, medical surgical floor, or the emergency room. We have 1 shift. So we can't just close the OR either because if somebody needs emergency surgery, we have to be able to be there. So there always has to be somebody on call. So we have an OR nurse that's on call. We have, the surgical tech that's on call. We have the anesthetist that's on call, the surgeon that's on call. So we have a number of people that are on call. So for our OR, we don't have an on-call pool. So you work your shift. You work your 8 hours, and then you're on call from 3 o'clock in the afternoon when your shift gets over. Hopefully it's over at 3. And you're on call until 6 o'clock in the morning when you're back at work. Now, if you have to be up in the middle of the night doing surgery or helping with the surgery, and same thing with the recovery, then you're here and you're still back to work the next morning. So it makes it kind of tough for us.
Is that an issue in your negotiations with this contract?
So it is an issue for the surgical services department.
I see. Okay.
And we are trying to put some caps on capping the hours, how many hours that somebody can be on call in a pay period. But we're a feast or famine department. So we either are working like dogs and we have lots of surgeries, and lots of after-hours surgeries, especially, in the summertime, good weather. We have a lot of people out there on the ATVs and hurting themselves. And then we get to the famine part. We have the surgeons that go on vacation, or they have family issues, and so they're not available, and they're not doing their surgeries, and so then we have to go home, what's called low census, because we don't have patients. When we go home low census, most of our people are primary breadwinners or only breadwinners, and so when we go home low census, we have to take those hours out of our vacation time to make up our paycheck.
Oh, boy.
So that makes it really tough, because then a lot of us don't have vacations because we have no vacation time because we've used that time to fill in our checks.
Oh, I see.
I want to touch base with the community support that we've had as our negotiations have evolved. We've started to involve the community in that, and they're very supportive. We have signs up throughout the town that say, "I support Peace Harbor nurses." And we've had a unity coffee event that the community came to. And then we have an upcoming community event.
We do. It's going to be scheduled it is scheduled for April 4th. That's on a Tuesday. It is at the Senior Center.
Okay.
It's from 6 to 7.
Okay.
6 o'clock till 7 o'clock.
Uh-huh.
We're hoping to have a few keynote speakers.
Wonderful.
I think we have the mayor signed up and one of the commissioners, and I'm not sure who else will be there. But it's also a good time for the community to come and ask us questions. We need the community's involvement, and we need to have them help us to get our information up to Vancouver.
Okay.
Our regional area, our little hospital, our administration there, they support us.
Okay.
But they can't do everything because they aren't at the negotiating table.
Oh, I see.
It's corporate that's at the negotiating table.
Oh, I see.
And we need to get corporate's attention. And we will try and keep the community informed as to what the next steps will be.
All right.
Yes.
And I really appreciate you both coming down here today and talking with us. Thank you.
Thank you for having us.
Thank you, Pip.
Okay. This has been Pip Cole for Community Conversations. And we hope you will continue to listen to this program and support local community radio, KXCR 90.7 FM.
This has been KXCR Conversations with you, a regular feature here at KXCR. Having a conversation is easy. Call 997-5252. Email info@kxcr.net. Or visit us at the station across from the library. Our combined history makes our community. We all have the energy and power to do good things. Organizing and energizing ourselves is a great step in conversation. This is Community Radio, KXCR, Florence, 90.7.